good afternoon, ma'am. First of all, just for the camera, your name and designation, please, ma'am.
I'm Dr. Kanika Sood. I'm Director and Clinical Lead at Dharamshila Narayana Superspeciality Hospital, Delhi.
Thank you, ma'am. Ma'am, just two quick questions. My first question to you is, looking at the current infrastructure of our healthcare facilities and all the awareness and accessibility, all that has been spoken of, what is your view when it comes to a margin of improvement and a margin of more efficiency if you feel that it's not enough? So what is your perspective to that, ma'am?
So, see, healthcare in our country is polarized. We have two healthcare systems. One is the public sector and one is the private sector.
Yes.
So when we come to the private sector, it is working more on value-based, outcomes where more things are getting structured. There are metrics to analyze it, which data-driven, analysis is guiding us how we can improve our efficiencies. But a similar format does not exist in the public sector. There is no accountability in terms of the finances which come in and the amount of, the work which is done on ground. So I think a more accountability in the public sector, so that the taxpayers' good money which is going to these institutes. We are having so many beautiful All India Institute Medical Sciences being built across the country. So some accountability on how at the ground root level has that financing really worked. Because for the private sector, each penny is counted. So I think a little bit of push and a little bit of accountability does improve your efficiency.
Okay.
Otherwise, medical science, doctors are tuned, the nursing, the paramedics, we are tuned to work 24 hours. So it is not the human capital which is not efficient, but it is the systems which need analysis time and again.
That's a very good answer, ma'am. Thank you so much, ma'am. My last question to you before I let you go. Ma'am, what are the main challenges you feel that the Indian healthcare ecosystem is facing as of now?
So I think it is the equitable distribution first and the foremost.
Yes, ma'am.
Our metropolitan cities have best of the treatment equipment. We can boast of that whatever is available in the Western world, we have that. But the accessibility to the larger population which actually needs it is less. That is one of the biggest challenges which we need to address. And second thing, since I'm an oncologist, I think health literacy. That needs really a push, because unless people are knowing what is happening to their body, they cannot be in charge of their health. Because a lot of delays which happen in diagnosis happen because of non-awareness at the patient level. He doesn't know there's something wrong with his body. So by the time he reaches out to a doctor or to a healthcare facility, sometimes things are already, they are not repairable. So health literacy is something which should be introduced into school subjects. I'm very, very passionate about that, because that will change the healthcare scenario of our country. Because then we will not be dealing with non-communicable diseases. We will be just dealing with, infective diseases and other things. So that needs to be really pushed at the hospital level as clinician and as, the thought, the think tank of the country needs to push that.
Thank you so much, ma'am. That was very insightful and your perspective is excellent. It's very positive. Thank you for your time and pleasure talking to you.
Most welcome.
Thank
Pleasure
you, ma'am.